male infertility today. What causes male infertility? Before I go on to that, I will quickly explain how pregnancy is achieved. Hello everyone, my name is Dr. Babatunde Okewale and you're welcome to this edition of How to Get Pregnant and Have a Baby. Today, we'll be talking about male infertility. Why is it that important? Part of the reason is up to 50% of causes of infertility is due to the male factor. Another reason is a lot of men are in denial, and some men actually equate having a good erection or being very good sex-wise to being fertile. And what this does is it wastes the time of the woman sometimes. There's also this belief that all forms of infertility are due to the female factor. So we'll be talking about male infertility today. What causes male infertility? Before I go on to that, I will quickly explain how pregnancy is achieved naturally. There are basically 5 requirements to get pregnant naturally. The first requirement is the sperm of the man has to be of good quality and it has to be of good quantity. The second requirement is the woman must be seeing her menstrual period regularly. So she must be able to predict her fertile period and also to be able to know when she's ovulating. It is only during a woman's fertile period that if they make love, that pregnancy can occur. The third factor is the inside of the womb of the woman has to be able to accept and be able to keep a pregnancy. So there shouldn't be anything in there that would disrupt pregnancy. Whether it's a fibroid, whether it's a polyp, whether it's adhesion or anything shouldn't be inside the womb. The fourth thing is the fallopian tube of the woman must be open, because it is in the fallopian tube that fertilization that results in pregnancy occurs. It is that organ where the egg of the woman and the sperm of the man meets in fertilization. And the fifth and final thing is the woman must be producing quality eggs every month. Now, of all these 5 requirements I have mentioned, you will notice straight away that only one involves the man, which is the sperm. But that one contributes to 50% of all infertilities. So what are the causes of male infertility? The number one cause in our environment here is infection. Quite a lot of men do get infected with sexually transmitted disease, and they might not even be aware of it. And that's why the issue of contraception, if you're having unsafe sex or you have multiple partners, you have to use a condom. The kind of sexually transmitted disease that men used to have in the past, things like gonorrhea, are easily treatable now with the multiple and very potent antibiotics in the market. And if you do have gonorrhea as a man, within a few days, pain on urination, etc. But the kind of sexually transmitted disease that is rampant nowadays, you might not even know you have it. The name of that infection is Chlamydia. Chlamydia infection is a very silent infection. It is sexually transmitted, not easily treatable, and by the time you know, it has caused a lot of damage. especially in the testicular area. So infection is a major cause of male infertility. What it does is it destroys the testicular tissues and reduces sperm count. Another cause of male infertility is what we call testicular heat. The testes are situated in the scrotum, and the scrotum is outside of the body. And there's a particular reason why the scrotum is outside of the body. It hates heat. The comparative organ to the testicle in a woman is the ovary, which is inside of a woman's body. That one can stand heat, but the testicle cannot stand heat. That is why it is placed in the scrotum outside of the body. Anything that will make the testicles heat up would result in low sperm count. And there are quite a few things. There are certain professions that generate heat in the testicular area. One example is men who drive trucks and lorries and go on long distance journeys and are seated on the same spot for a very long time. That generates heat. And in the past, there are some trucks that the engine of the truck is right below where the man or the driver is sitting in. That generates a lot of heat as well, and that could result in testicular heat, which subsequently results in low sperm count. Other things are, some men, they like having very hot bath, or they like going to the sauna and expose their testicles to extreme heat. All those things result in low sperm count. Wearing very tight clothing, especially for men, especially men that wear skinny jeans and very tight pants, could also generate a lot of heat around the testicular area and result in low sperm count. Another reason why men have low sperm count or causes of male infertility include lifestyle things such as smoking. It's been found out that any man that smokes above 20 cigarettes per day, there is a tendency that their sperm count will be lower. Same thing with alcohol. There are also some environmental issues that affect sperm count. Generally speaking, it's been found that over the last 30 years, the sperm count of men has been gradually decreasing. And this is due to urbanization. And it's also due to environmental pollutions that are very rampant these days. There are certain industries that are actually dangerous to the men. Men who work in the paint industry or in any industry that heavy metal is used. Metals such as lead, they are very toxic to the testicles. There are also some pesticides that are used in the agricultural industry that are toxic to the testes of men. Radiation. Men who work in the X-ray department have to be very careful to make sure they are properly protected. Other things are a particular disease process called varicocele. Varicocele basically means the veins that surround the testicles are numerous or they are dilated. And what happens is, whenever there's any blood flow around the testicles with the veins that supply it, they generate heat. So if a man has excessive veins that the blood flow through those veins are excessive, then heat could be generated. And a process or a disease process called varicocele could easily be detected if the doctor examines the man. Other things are hormonal imbalance. There are some men that just don't produce enough male hormone, which is the testosterone, which helps in sperm production. Obesity, strangely, has a say in male fertility as well. Men who are very obese, with very big tummy fat that is folding over onto their thighs, are prone to low sperm count. Why? Because those fat overlays also generate heat that could affect the testicles. So how do you diagnose that a male has infertility? One of the simplest tests for infertility is the one you do for the male. And the number one test is a test we call semen analysis. There are other tests that can be done, but the gold standard in any male infertility test is the semen analysis. Other tests such as scrotal ultrasound scan, rectal ultrasound scans, and the rest usually follow from the semen analysis if there is a problem there. So when you do a semen analysis, what do you expect to see, and how do you interpret the finding? A semen analysis is usually done in a man who has abstained for at least 2 to 3 days. And what he does is he produces the sperm, takes it to the hospital within 30 minutes to 1 hour, and the lab scientist would check the semen under the microscope. The lab scientist will be looking out for 5 things. The first thing is, what is the volume of the sperm? The second thing is, what is the count of the sperm? The third is the morphology. We want to know what the shape of the sperm looks like. The fifth thing is whether there are any bacteria in the sperm. And finally, we want to also know about the motility of the sperm. Now, the normal figures are this. The normal volume for the sperm count ranges from 2 mils to 5 mils. So anything within those range is a good volume, between 2 mils and 5 mils. The normal count, sperm count for a man, is supposed to be between 20 million per mil to 200 million per mil. So anything within that range is good sperm count. Anything below 20 million is termed low sperm count.